The ophthalmic nerve, which is the first branch of cranial nerve number 5 or trigeminal, contains general sensory fibers, and it originates from the trigeminal ganglion, the sensory ganglion of cranial nerve number 5. This one passes forward along the lateral wall of the cavernous sinus, and it divides in 3 branches: a lacrimal branch, a frontal branch, and a nasociliary branch. The nasociliary nerve passes medially and superior to the optic nerve, and then runs anteriorly along the upper margin of the medial rectus. It ends by dividing into an anterior ethmoidal and infratrochlear nerves. Here's the anterior ethmoidal. Here's the infratrochlear. This nasociliary nerve supplies the eyeball, the mucosa of the ethmoidal air cells, and the sphenoidal sinuses, the mucosa of the anterior part of the nasal cavity, and the skin of the nose. The frontal nerve passes forward immediately above the levator palpebra superioris, which is this muscle right here, and it divides into a supraorbital and supratrochlear nerves. Here's the supraorbital. Here's the supratrochlear. The supraorbital nerve passes through the supraorbital notch or foramen. In some people, they will have a notch or a foramen. And this one supplies the mucosa of the frontal sinus, upper eyelid, forehead, and the anterior scalp. Meanwhile, the supratrochlear nerve passes above the trochlea of the superior oblique muscle, and it supplies the upper eyelid, the forehead, and the anterior scalp, medial to the supraorbital nerve. Now let's talk about the arteries of the orbit. The main blood supply is going to be provided by the ophthalmic artery. This is a branch of the internal carotid artery, which is that portion right there. And this branch enters the orbit via the optic canal, and it ends by dividing into a supratrochlear and a dorsal nasal arteries. There's also another artery over here called the infraorbital artery, which is a branch of the maxillary artery, and it supplies blood to the structures close to the orbital floor. Other branches of the ophthalmic artery include the posterior ciliary arteries, which are these ones right here, and these ones supply the eyeball. We also got the muscular branches, which supply the extraocular muscles. We also have a lacrimal artery, which accompanies the lacrimal nerve. And we have a supraorbital artery, which accompanies the supraorbital nerve. There's also an anterior and posterior ethmoidal arteries. This is the posterior ethmoidal. This is the anterior ethmoidal. And they accompany anterior and posterior ethmoidal nerves. There's also a supratrochlear artery, which is this one right here. This one accompanies the supratrochlear nerve. And there's also a dorsal nasal artery. Other branches that we're going to find supplying specifically the retina is the central artery of the retina, which pierces the optic nerve and passes forward in the center of the nerve, and it's accompanied by the central vein of the retina. This one enters the eyeball at the center of the optic disc, and it branches and spreads over the internal surface of the retina. Now let's go over the veins. There is a superior ophthalmic vein, which communicates anteriorly with the facial vein, and it's usually joined by inferior ophthalmic veins, and it passes through the superior orbital fissure to drain into the cavernous sinus. And there is also an inferior ophthalmic vein, which communicates anteriorly with the facial vein, which is this one right here. And it communicates posteriorly with the pterygoid venous plexus, and it usually joins the superior ophthalmic vein, but may drain directly into the cavernous sinus.